All too often, vulnerable patients who are ready to be discharged from hospital are kept in simply because they physically can't get home. West Midlands Fire Service's Back Home Safe and Well initiative means that difficult journeys become easier. But as Carolyn Sim reports, it's far more than just a taxi service.
It's 9:30 in the morning and West Midlands Fire Service is responding to a call. But there's no emergency and no fire. The team are off to collect a vulnerable person from hospital and bring her safely home.
We'll just make sure that she's got keys to the property.
It's a new initiative called Back Home Safe and Well. Today, 94-year-old Betty England is well enough to go home, but has no family to take her.
Okay, is that all right?
Yes.
Yeah.
Without the help of the fire service, Betty would have to wait on the ward, possibly for days, for an ambulance to become available.
Oh.
That's it. Home.
While they're here, the team will check Betty's home is safe from fire and other dangers. They can arrange for a second visit or call in one of the fire service's vulnerable persons officers, who can work with other agencies to ensure Betty remains safe in her own home.
What does it mean to you to be home?
A lot. I mean, I'm home on my own by choice. There's nothing like it, is there? Yeah, I'm happy to be home.
This new partnership between the Fire Service and Coventry and Warwickshire NHS Trust is easing pressure on the ambulance service and freeing up hospital beds.
For every patient that we have in a bed on a ward, that means at the moment, in a hospital as full as this, that one patient can't move in from the emergency department onto that bed on the ward, and somebody else can't move off an ambulance trolley into a cubicle. So by discharging somebody early on from a ward or from the emergency department, it has a knock-on effect of our ability to assess the patient behind them in a timely manner.
At Dudley Fire Station, the brigade response vehicle is fitted with more than just firefighting equipment. It has everything needed to help someone who's had a fall. The Falls Response Team, based here, work in partnership with Dudley Council's telecare service. West Midlands Fire Service provide out-of-hours and weekend response to thousands of elderly people who use assistive technology like wristbands and tags. Many of these people aren't on the radar of local agencies, so the Fire Service carry out a safe and well visit a couple of days later.
We've got incidences where the fire service went out after a faller, went out to somebody and identified that that person needed a smoke detector installed. A couple of days after the fire service had the telecare alarm had been installed, the fire service had to be deployed because the person had a fire in the property. They treated the person for smoke inhalation, and the commander said that if it hadn't been for the linked smoke detector, that person would have died. So that is partnership working, and that's what we do in Dudley.
Not only are we removing sort of high quantity calls from the NHS from non-emergency falls, we're also providing that wraparound prevention service so the falls won't happen again in the future. Working with our health partners in the NHS and our firefighters, we've managed to diversify and change the way that we respond to incidents, so they will identify people who are vulnerable from a health perspective, and then potentially we'll meet people in our day-to-day business and realise that, you know, they are vulnerable from fire, but the underlying cause for that will be related to a health issue.
West Midlands Fire Service can not only get to you quickly when you need them, they can prevent fires and falls, and they're making an increasing contribution to public health. Theirs is an evolving and valued role in the communities they serve.